Now, our next topic is obsessive compulsive disorder. What is obsessive compulsive disorder? Obsessive compulsive disorder consists of two parts: obsessions and compulsions. Now, what is obsessions? Obsession is persistent, unwanted, repetitive, intrusive thoughts, images, and urges which are ego dystonic and cause anxiety and distress. So unwanted thoughts that causes anxiety and distress, and to relieve this anxiety and distress, the patient do certain actions in response to these unwanted thoughts that are known as compulsions. This is known as obsessive compulsive disorder. Now, what are the common obsessions that a person with OCD can have? The most common is fear of contamination, that he may get contaminated with germs. So that's why fear of contamination result in distress and anxiety. And in response to this obsessive thoughts, the person perform cleaning or repeatedly cleaning or washing the hands. So repeated cleaning and washing as a result of thinking of fear of contamination. This is the most common example of OCD. Other example include pathological doubt. So due to pathological doubt, the person will do repetitive checking, such as repetitively checking the locks of the doors. Another example is sexual or violent intrusive thoughts, fear of causing harm, need for symmetry and exactness, religious obsessions, and superstitious obsessions. For example, repeating the activities certain number of times. For example, the patient will say to you that he turn on and off the light uh, for about 5 times. If he does not turn on and off the light 5 times, then he get anxiety and distress. So this kind of history will be given to you. So three of them, they are common. That is fear of contamination, need of symmetry, and superstitious obsessions. Now, we discussed that a form of ECD is that the person will have sexual or violent intrusive thoughts. This kind of OCD is called sexual OCD. And in sexual OCD, the person usually, there's an extreme fear of being attracted to a family member, an animal, a dead inmate, or objects or children. So inappropriate sexual thought is a common feature of sexual OCD. There can be intense fear of committing a sexually heinous act, extreme fear of becoming violent during sex. So these are the features that can be present in sexual form of OCD. Similarly, violent thoughts, that is in which the person will see themselves hitting, stabbing, or strangling, or mutilating, or causing injury to their children, their family members, strangers, pets, or even themselves. So in Plab 1 exam, the patient will present to you with a history of checking the doors several times. This is the most common scenario. Or that he will give a history of turning the light on and off several times. Or there will be a history of washing his hand every time he touches the door lock. So these are the three most common scenarios by which question about OCD will be asked. First line treatment for obsessive obsessive compulsive disorder is cognitive behavioral therapy. It is usually better than SSRIs. Cognitive behavioral therapy consists of exposure and response prevention, because exposure and response prevention is a part of CBT, so it can be right answer as well. What is ERP? Exposure and response prevention. It is a therapy that encourages the patient to face his fears and let obsessive thoughts occur without doing anything, or without neutralizing them with compulsion. So that's why CBT is the cognitive behavioral therapy, or ERP, that is exposure and response prevention, are the mainstay of treatment that can be used in the management of obsessive compulsive disorder. Initially, if the symptoms are mild, low intensity CBT can be used, or if the symptoms does not respond to low intensity CBT, then we can use high intensity CBT. And if the patient does not improve with this CBT or cognitive behavioral therapy, then SSRIs can be used as a second line medication for the treatment of OCD. SSRIs such as escitalopram, fluoxetine, sertraline, or paroxetine, they can be used as well if the patient does not respond to low intensity CBT or high intensity CBT. Note that people with obsessive compulsive disorder, they have relatively good insight. They know that they have a problem. Now, after CBT and SSRI, first line is CBT, second line is SSRI. Now, when will you choose ECT or electroconvulsive therapy in the treatment of OCD? So for Plab exam, remember that if a person with obsessive compulsive disorder is suicidal or severely incapacitated, then ECT will be the treatment of choice in such patients. Now, a short description of low intensity CBT and high intensity CBT. Principle of both of them is same. The only difference is that in low intensity CBT, there is usually up to 4 to 5 sessions, and it can be done face to face or on telephone contacts. While on the other hand, high intensity CBT is there are usually more number of sessions, such as 12 to 20 sessions, and it is done face to face. So this was all about obsessive compulsive disorder and its treatment.
So I have two questions. One is, what is this ERP? I mean, like exposure and response prevention. How does that work? I mean, like the patient is exposed to something, and then
yes, patient is exposed to the things about which he gets these obsessive thoughts, and then he is encouraged to not to do anything, not to do compulsion to relieve the anxiety.
So if, for example, he is locking and unlocking the door again, would they just bring him in that scenario, and then
he will be encouraged he will be taught in the session that you need to control your urges. If you do not check the logs again and again, nothing will happen. So the patient will try it at his home. During the session, only the consultant or the psychiatrist will guide him, will advise him to change his behavior. This is basically the principle of, that is why it's called cognitive behavioral therapy. That
Right.
the person or the patient is asked to do certain things to control his disease.
Right. And the second question is regarding ECT. So he said that it should be used when the person is suicidal. So what is the meaning of if he's severely incapacitating? What does that mean?
Incapacitated mean inability to take care of himself, but it means he forget everything else. He is just only lost in his obsession. So much lost in his obsession that is continuously he's washing his hand. Even you can say 24 hours he's washing his hand, continuously washing his hand. He's
Right.
not doing anything else, not eating, not drinking, not doing anything, any activity that is required to continue his life.
Right. That's fine. Thank you.
Any more questions?
Yes, I had a question.
Yes.
What the age range for OCD? Can it occur in a 5-year-old? Can it occur in a teenager or afterwards? Or is it like a whole spectrum from like, I don't know, mid
It
childhood?
usually occur in the adults, because in children, children usually does not know about germs and all these things. So when a person has an awareness about the germs, that germ causes diseases and that germs are present in the environment, so usually adults will get this disease that is known as OCD,
Okay, but
because
what would you
children
say?
cannot. Yes.
Sorry, what would you say in the current world that we live in now with COVID?
Can you please speak a little louder?
Can you hear me now?
Yes.
Yes, I'm saying, what would you say for like the current world that we're living in with COVID-19? Most children are aware about it and it's terrifying. I have heard a few cases here and there. That's why I wanted to know your thoughts on this as well.
So as you're saying that the children also has awareness, so yes, they may also develop OCD, but it is less common in children.
Okay.
Even if the children get it, then the treatment will be same. That is cognitive behavioral therapy through involving their family.
Okay, thank you.
But because it is less common in children, so it won't be asked in the Plab 1 exam. So we'll focus on the form that occurs in the adults. Any more questions?